have a question, you don't want to broadcast it live to the nation, then by all means message me privately, email me info@staianoplasticsurgery.co.uk, or put it on Facebook or Twitter. I'm sure there's private ways of doing that, and you can, and whenever I talk about the questions, I don't mention who you are. So I'm if you want to say who you are and come on live, that's absolutely fine, but I will not mention your name because that's just how I roll. So hi Jackie, good to see you here this evening. First, you know what it's like when you suddenly think of something. Because straight up, I got a video, I got a photo question, and I'm set on Facebook on that. I can show the photo. I haven't thought it through on Instagram. I can do it on Instagram, but I think I'd have to get it on my phone. I have to email. I had this problem last week, didn't I? Not a problem. I'm not gonna dwell on it. So question is, look at that, you can see the phone there. Question is, could I have a tattoo excision on this damaged tattoo? So if I'm just going to show that photo on Facebook like that, and okay, that's probably big. And then what I'm going to do is I'm going to show it on Instagram. Actually, you know what I'm going to do? I'm going to reverse the camera. Oh no, sorry. I've got my case on my phone. Is it? Oh, look at that! I can see what you're seeing on Instagram. Oh my god, that's weird. So I need to go down. I need to go across. No, I'm seeing myself. How do I do it? Go across. No. Hold on a minute. Let me get my head around this then. If I can see on the Facebook, actually that doesn't help, does it? No. Okay. There it is. There you go. Simple as that. Can you see that? So there's a forearm, and there's a big tattoo on the forearm. We need fancy software, huh? There you go. So could I have a tattoo in this damaged tattoo? Right. Well, the fact that it's damaged is not actually that much of an issue, because if the way I do tattoo removal is by excision, so I actually cut the tattoos out. So I cut that skin out. So to be honest with you, it doesn't really matter what's on that skin. It could be a tattoo, it could be a scar, doesn't matter, because I remove that skin. So the the damaged nature is not that much of an issue, although the damage, it's hard to see, but it might be going outside the area of the tattoo. So if you're stitching damaged skin together, that might be a bit of an issue, but really the damage is not an issue. But what is more of an issue is the fact that the tattoo is quite large and it's here on the forearm, and that is too big, basically, because I can't remove all of the skin of the forearm, the whole skin of the forearm, and then I can't stitch it up because you're never going to get it stitched. It's just too big. It's just too big. I mean, could it be done? I mean, often it's like, could it be done? Well, could you do a serial excision? But goodness me, you'd have to be doing so many of them. So many serial excisions, it just wouldn't be worth it. Hi, Khan. How are you? Actually, Khan, I haven't checked. Should I have checked my messages to see if I've got questions? I just remembered that. I would say if serial excisions is probably not a goer. And the other thing that I think a lot of people think about when they're doing tattoo, when they're having tattoos removed, is they think skin graft. I think that's a natural thing that people think, oh, I have a skin graft on my tattoo, to get my tattoo removed. And I mean, never say never, but I never do it. Basically, because skin grafts just don't look good. I mean, could you remove this big tattoo and put a skin graft on it? Well, yes, you could, but I would not do it because I think that the skin graft will look worse than the tattoo. Now, you might say it's got sentimental connection and I just want it gone because and I don't care for the cosmetic point of view. And I think in those situations, there is a marginal argument to possibly, there might be a situation where you might consider it, but it's got to be pretty bad. Oh, here we go. Oh, here we go. Here we go. Oi, oi. Oi, oi. Ooh, hello. Oh. Oh. So, I would basically don't do skin grafts. As I say, it can be done, but there's a difference between what can be done and what sort of should be done, or whatever. So I don't do it. So I just think this one is too big, basically too big on the forearm, and I'm really sorry. And I don't know what the damage is all due to. I don't know if it's due to lasers or something, or I don't know what's happened to that, but it's pretty limited, to be honest. To be quite honest, am I a bit off center? What I can do with tattoos, because I have to be able to cut them out. So I can't really do these really big ones that people send me over the shoulder and the whole of your back and all that sort of stuff. I can't really do that. And I would always say laser's the first line for any tattoo, really. Khan, I didn't have any to say this week. Thank you, Annie. You're welcome, Khan. Thank you. It's fine. Kelly, I'm not sure if we'll know this, but what's your thoughts on WLS? WLS. Well, I'm glad that Instagram has paused due to poor connectivity. Oh, it's back. Oh, it's paused again. WLS. Now, Kelly, what is Facebook's restarted itself? I don't know if this is. I don't know what's going on. Is it working? Anyway, I'm going to answer the question as if WLS is weight loss surgery. If it is different, let me know. So weight loss, yeah, Kelly, I'm not the right person. I don't know is the answer to that. I don't know I don't know whether whether weight loss surgery is. I mean, I think it's a growing industry. I do know that, and I do know that it's effective, and and really it's not my field. And I know that for some people it is a very good thing to do. But I also know that it's not without its issues, and you have to be counseled about it, because it has to be you have to be aware of what is achievable and whether it's right for you. But Kelly, it's totally not my field. There are different types of doctors who do that sort of thing. Bariatric surgeons, they're known as, and they would be probably better placed to advise you on that, because it's not something that I have expertise in. So in fact, I'm going to stop there, Kelly, because I'm probably going to say something that's not very accurate, because I don't really know much about weight loss surgery. I normally see people once they've had the weight loss surgery. So there's different ways of doing weight loss surgery, and I would see people once they've had it. I don't get involved at all in the decision making as to which way to have the weight loss surgery. I'd say that would be a different specialist. So sorry, Kelly, about that. Weight loss. It is weight loss surgery. There you go. Good. Phew, that was good. Didn't answer the wrong question. Do you get better results from lipo if you wear your compression garment for longer than 6 weeks? I don't think so, Zoe. It's difficult because everyone wants the best result, and yet you'll find that people have different regimes in terms of compression garments, etc. And I suspect, I know it's not very scientific. They've probably done studies on it. I haven't seen studies on it, but I suspect the results are going to be pretty similar. I think it'd be hard to demonstrate better results. For me, the compression garment is for support, and it is for your comfort during your recovery. And I think, give or take, unless you're doing massive liposuction and you're wanting skin to redrape in a certain way, I think that it will probably not have a huge effect on the outcome. But for me, the main reason for compression garments, or what I would say is support garments, is how you get to your outcome. And I think if you have a support garment, you will have an easier post-op recovery, and you will get to your end point quicker and more comfortably than if you didn't have a garment. So that's the main reason for the garment. I don't necessarily think it's going to have a huge effect on the outcome. I mean, I'm sure there are situations where maybe people overdo it and it all swells up and the skin stretches and it doesn't redrape very well. So there may be an element to it giving a better outcome, but I don't think that's a huge element. I think the main element for me, anyway, this is my view, and I think it would probably be, I think you probably would get different views from different doctors. But my view is that the support garment is more for your support, more for your comfort, more to help with swelling and more to help with the post-op recovery. And I normally say to people to wear it for 4 to 6 weeks because I think that is a reasonable time frame. Having said that, you will probably have swelling. I normally say it really starts to settle about 3 months. So even at 6 weeks, I think you will still have swelling and there will still be things to settle. But I normally tell people that 6 weeks, because I think that is a manageable time frame. I think if I say to people they've got to wear their garment for 3 months, that's quite a big deal. Now, some people choose to wear the garment for longer, and if it's comfortable and you feel uncomfortable not wearing it, then by all means wear it for longer. But I think 6 weeks for me is a compromise between a reasonable time frame to expect someone to wear the garment, because they can be bulky and they can be a little bit cumbersome. Versus where the sort of worst of the swelling is, if you like. But the swelling's probably going to really start to settle around 3 months. So, you know, it wouldn't be unreasonable to wear it for 3 months, but I think that's a big deal. But I don't think at a year or at 2 years or at 3 years, a significant difference between someone who's worn the garment for, 3 weeks versus someone who's worn the garment for 3 months. I don't think. Although there's a study there for us we should make it scientific and do the study. Good question, Zoe. Well done, Zoe. Anyone out there can beat Zoe for that was a good question. Not that the WLS surgery, Kelly, that was a good question too. So I don't want to, you got to be careful. I don't want to give too much praise on one, but Zoe, good question. Also, Kelly, good question, WLS. Any other good questions out there? Very happy to receive them. Weight loss surgery is what I correctly guessed. That was a correct guess by me. Thank you. Sealy, I can help with that. Oh, here we go. Sealy can help. Here we look at this. This is networking, guys. This is how it's done. Okay. Sealy, feel free to join my WLS group, Gastric Fantastic. I'm not medical, but I can help. Okay. That is synergy. Okay. I know nothing about WLS. Sealy knows everything about WLS. She's got a WLS group, for goodness sake. Oh my Lord, who knew? Kelly, can I point you in the direction of Sealy Shakespeare with her WLS group, Gastric Fantastic? Okay, so she's not medical, but she'll be able to help with your WLS questions significantly better than what I just did. So thanks for that, Sealy. Anybody else want to publicize their Facebook groups, WLS or otherwise? Feel free. Public service. Kyla, have you got a WLS Facebook group? No, someone did lipo, then tummy tuck, then lipo after tummy tuck. Is the okay? Someone did lipo, then tummy tuck, then lipo after tummy tuck. Is the okay? Okay, Kyla, I'm going to work with this. I'm going to work with this statement as much as I can, because I can make something out of this. I can make a question out of this. I know I can. Right, let's just break it down. Someone did lipo, then tummy tuck, then lipo after tummy tuck. Is the okay? Yes, you can do lipo, then tummy tuck. That's what I do. If I'm doing it within the same sitting, I do lipo, then I do a tummy tuck. But it does make the surgery more expensive. So some people, I can work with this. Some people don't do, you could just have a tummy tuck, and then if you're not happy, you could have lipo after tummy tuck. Yeah, is that what you're saying? So that would be reasonable. It'd be reasonable to do it either way. You could do a lipo at the time of tummy tuck if you really felt, and lipo for me at the time of tummy tuck is for the sides, it's for the hips and flanks, for these bits here. I mean, there's nothing there on me, it's skin and bone, but it's for those bits there. Lipo can help to contour those areas, but sometimes weight loss can help those areas. So you don't have to have it. So it'd be perfectly reasonable to have a tummy tuck in the first instance and then have lipo later. It would be more expensive doing it that way because it's cheaper to sort of bundle. That sounds bad, bundle, but it's cheaper to do two procedures at the same time because you get economy of, the theatre and the hospital stay, etc. So there is a price benefit. But if you don't need the lipo, then obviously you've made it cheaper because you've just done the tummy tuck. So yeah, either's okay, Kyla. Lipo, then tummy tuck, and lipo after tummy tuck is fine. Kyla's sorry, is that oh god, wait a minute. Kelly, if you could PM me the link, that would be great. Thank you. Who, me, Kelly? Do I have to PM the link? Or can Seeley PM you the link? Seeley, can you Kelly does it work like that? Seeley, can you PM Kelly the link to Gastric Fantastic? I'll just not get involved. I'll gloss over. But let me know if you need me to get involved and facilitate the link. Laura Leanne, how long after BA can I use a hot tub / bath? That is one which really is one for your surgeon, Laura. Always one for your surgeon, I would say. But in my practice, I usually have a dressing on for a week. The dressing's splash waterproof. You can get in a shallow bath, but I wouldn't soak it in a bath. But if you wanted to get in a shallow bath, like in the first week, you could. But I wouldn't soak it because it will just sort of float off. So after the first week, the dressing comes off. And then sometimes a little bit of ooze here and there. So you might need a bit of gauze in your bra for a couple of days, but pretty much after the first week you could get in a bath, to be honest with you. Hot tub, I'm not sure if it's different. I guess if you have got a bit of ooze on the dressing, so as I say, when we take the dressing off, we give some gauze to wear in your bra, and there might be a bit of stuff on the gauze for the first few days, so you probably want to wait till it's dry, because similar with like a swimming bath, if you want to go swimming, I would say wait till it's dry, so the gauze is no longer got stuff on it. So once the wound is sort of healed and dry, which let's just say 2 weeks for the sake of giving you round figures. So 2 weeks, I would have thought it'd be fine. But as I say, if there is any ooze or if there is any marks on your bra when you take your bra off, I wouldn't get into things like a hot tub or a swimming bath. But yeah, that's fine. And in fact, Laura, is that a photo of you in said hot tub on your Facebook profile? Very nice. So, okay, thank you, says Zoe. Can't remember what Zoe's question was. Oh, lipo, if you wear compression. Well, thank you, Zoe. I've got to be honest, that was a very, very good question. Is that okay? Kyla, is that okay? What, the tummy tuck lipo thing? Yeah, it's okay to do lipo after a tummy tuck. Absolutely fine. Sarah, are you performing surgery such as liposuction at the moment? Thanks for asking, Sarah. I didn't have that as a question on my. Oh, what's going on here? I didn't have that as a question on my list, but I'm glad you asked, because I think we should talk about that, shouldn't we? Every week, what's going on? Things are moving on, Sarah, in a positive way, despite the fact we're hearing lockdowns all over the place, local lockdowns, etc. Yes, I am doing more surgery at the moment, and what I'm having to do is expand the places that I do surgery at. So it's a bit of a balance, because I always say go close to home, don't go far away. When I'm but having to expand where I do surgery, and so the hospitals are starting to sort of get in touch and give hints that we might be able to get back in, and so I think there may be some movement there. And also the other area is there's clinics where you do local and sedation, so I am doing more, and I'm booking in lists, and things are moving in a very positive direction. And certainly something like liposuction is something that can be done, and I am doing at the moment. The struggle really is for the bigger ops. The combined ops is still a bit of an issue, but I can do pretty much anything as a single op, so tummy tuck, breast lift, breast reduction, etc. Breast implants, obviously, well, not obviously, but breast implants. But yes, doing more and more. And yes, so if you want to know, talk to Nicola at the clinic. She knows about what's going on and with dates and things like that. So if anyone wants dates or what have you, then that's a bit of publicity there. Talk to Nicola. What's going on in Instagram? We've got sorry, pressed wrong button, but after WS, I would always recommend you for boobs and tummy, and I do. That's what we need. Gastric fantastic, synergy. Gastric fantastic. I recommend you for weight loss surgery forums, and you recommend me for boobs and tummy tuck. Right? You scratch my back, I'll scratch yours. That's how the world goes round. Yeah. Right. Kyla Smith. Yes. Lol. Sorry. He did lipo, then a tummy tuck, then lipo after tummy tuck, left my tummy still loose. I've got to be honest with you, Kyla. It depends where we're talking about doing lipo, because this comes back to the lipo issue and what is lipo good for. And lipo is good for areas where the skin recoils well. And that's why I use it for the hips, the sides, the hips and the flanks, the sides, because the skin's thicker and tends to recoil well. The skin doesn't recoil well so on the central abdomen. So if you did a tummy tuck and then you did lipo to the central abdomen, you might have some skin less left, if that's what you're saying. You've got some loose skin. So I would actually, rather than lipo, I would say weight loss, actually, because lipo is good for when weight loss, for resistance areas of fat that don't respond to weight loss. So I don't want to sound like a bore, but weight loss is better than lipo. And I know, well, I can't, well, you maybe not can't lose weight, but if you can lose weight, you're better off doing that first, lose weight first. Your tummy might be worse. You might have more loose skin, but you do that before you have the tummy tuck. Because if you have a tummy tuck, we make it as tight as we possibly can, and then you lose weight afterwards, or you do lipo afterwards. They both do the same thing. They remove fat. If you remove fat from the tummy, but not skin, and then you might have some loose skin. So yeah, I think so that's a slightly different thing, actually. So I think, yeah, you want to get in the right place before you have your tummy tuck. So if your weight's not right, I always say to people, if your weight isn't right, I would say that you should get your weight right first before having a tummy tuck, because you're going to get a better result. You're going to have less risk of complications, but you're going to get a better clinical result because you can make the skin tighter. You might feel worse. You might look worse the more weight you lose. And sometimes, particularly people who've lost a lot of weight, actually feel better putting a bit of weight on when they've lost a huge amount of weight. They've got so much hanging skin, they don't feel good about themselves, and they feel better putting a bit of weight on to fill some of that skin, which I understand. But at the same time, if you want to have body contouring surgery, you're better off getting down to your ideal weight and getting down as low as you can, making it hang as much as you can, if you like, because then you can make it as tight as you can, because it's bad news to lose weight after a tummy tuck, or, as I say, lipo will be the same. That is the risk of doing lipo to the tummy, that it doesn't make the skin recoil, and so you could have loose skin. So lipo to the tummy, to the central tummy, in my hands is not great. I do it really for the sides. I don't think lipo to the central tummy works well personally, but that's my personal view on that. What's going on? What is going on? Gastric. This is serious question, right? If I hypothetically gained a stone, can I still have a tummy tuck and just get it all off? I'm asking, can you literally pay to be thinner? Asking for a friend. Well, a tummy tuck will remove the skin and fat from your tummy, so it will remove weight. There is weight that's lost when you do a tummy tuck. A stone's quite a lot of weight, and it would just be removed from the tummy, obviously, when you do a tummy tuck. So it wouldn't globally. I think when someone's sort of overweight and says, "Oh, I'm overweight and I've just won the lottery and I want to have surgery to make my body, great," it's like surgery is really good when it's directed at certain areas. It's not good when you say, "Right, what can you do, doc?" Where I want the whole lot done. That's not great. It's really for localized areas. So a tummy tuck is really for contouring the tummy, tightening the skin of the tummy. Yes, fat is removed, but it's a contouring procedure to tighten the skin of the tummy, and that's what it's really for. It's not a weight loss procedure. And so I would think you might be disappointed if you said, "I put on a stone and I'm going to go and pay the plastic surgeon to get it off for me," because all the plastic surgeon would do would try and take a big wad of skin out of your tummy. And if you were carrying extra weight on the rest of your body, they do nothing about that. So again, weight loss really is the way to go. Oh, you just answered me. I don't like that. I just want it off. I mean, she does. Yeah. So yeah, and people don't like it when you say that. Yeah, it's quite common. People say, "Oh, I want to pay," but you're better off losing weight first. Absolutely. Laura, it is. I want to book a celebration break at Christmas around 6 weeks after BA. Yeah. Oh, for the hot tub, is it? Is that the hot tub? Yeah. So 6 weeks after BA, hot tub should be all right. Laura, should be all right. Yeah, sounds good. Sarah, I have an appointment with you tomorrow, so we'll chat to you then. Have you, Sarah? Looking forward to seeing you. Excellent. So I will see you tomorrow. And what were you asking? Oh, liposuction. Yes, definitely. Good. Thank you. Well, good. That's what we need. Excellent. Right. So what we've got here. Can I get a crescent lift under local anaesthetic? Yes. Short answer, yes, you can. Long answer, a crescent lift for me is not a great lift, to be honest. To be frank with you, a crescent lift is not a great. In fact, I drew a picture of it. This is what I drew a picture. Oh, this is what I prepared, right? Right. It's on the back of an op note. This is a crescent lift. So this is the breast. This is the nipple. A crescent lift just takes a crescent above the nipple to sort of lift the nipple. That's in my scrap paper pile. That's what a crescent lift does. And I don't think it's not something that I do really very often, a crescent lift. So if you did do a crescent lift, yes, it could be done under local anaesthetic. They can be done under local anaesthetic. There's a couple of problems with crescent lifts. One problem with a crescent lift, because you're just taking a crescent from above the nipple and you're just lifting the nipple, you're asymmetrically taking more skin, obviously, from above the nipple than below. So there's a risk that you can elongate the nipple. You can make the nipple, instead of a circle, you can make it into sort of an oblong shape. So that's risk number one. The other thing is it's not really lift. I wouldn't call it a lift. A lift, for me anyway, suggests tightening the breast skin and lifting the breast and moving the breast higher up on your body and making the breast more pert, if you like. And the crescent lift just really lifts the nipple. So the way that I would really use it is for a nipple height asymmetry. So if one nipple's a bit higher than the other one, then you could maybe just do a little bit of a lift of one of the nipples to give balance. So it's more of a nipple height balancing thing, it's sort of like a nipple height lift rather than a breast lift. It doesn't really tighten and lift the whole breast. It just really lifts a nipple. So it can be done at local anaesthetic, but it's a bit of a niche procedure for just balancing up nipple height, and there's a risk that the nipple may become elongated. So that is something to be aware of. Are the GA procedures performed locally to the clinic? Oh, I said we wouldn't talk about this, and we obviously are talking about this. Well, this is an interesting point, because we've had discussions about this, because people often say to me, I want to have surgery and I live in Essex. And I say, you need to go locally, because there's lots of very good surgeons in Essex, and there's lots of very good surgeons in Aberdeen and in Dublin and in, wherever, Spain, France, wherever. You need to go locally. So when people contact me from far away, I always say go locally. And where I operate is in Birmingham, because that's where I am based. Now, that was back in the day. Do you remember the old days? Things have changed, and I haven't been able to get certainly into a GA theatre for GA being general anaesthetic. I don't know if that's a well-known abbreviation, but if operations you get put to sleep for, so the bigger procedures, since March. So I haven't done a general anaesthetic case since March. Now, general anaesthetic cases are being done in the country. There's not a problem with that. There's no sort of restriction on it. The problem with it is that the hospitals that I work in the Midlands have all been taken over by the NHS and have contracts with the NHS, which it seems are operating until Christmas, and they're saying after Christmas they'll come out of it, although who knows what's going to happen with the numbers of the coronavirus. So at the moment we're hoping we're going to get back in after Christmas, but that does leave us a few months before, in between now and Christmas. What do we do? So we are looking around and about, and there are options around the country. There are places where we can do procedures around and about, and so there will be options. I've got friends who've got clinics and have got facilities that I will be able to use. So we will be talking to patients about whether they're happy with that and whether they're happy traveling. I'm certainly happy traveling. I mean, it's not going to be far, but up north, down south. So we might have to travel for the procedures. Obviously, it would still be me, and all the follow-up will be done at the clinic locally in Birmingham. But we are looking at doing procedures further afield to the clinic certainly for GA procedures, for where you get put to sleep for the bigger procedures. So normally, yes, at the moment, we're looking to expand out. And we'd have a discussion with you how you felt, whether you felt comfortable with that, because it is a work in progress at the moment. So SJ Small Page, hi SJ. Kelly is in the house. She's back. Kelly's back. Kelly, you are back. Last week you were down. Now you're back. I just want to say, having my sedation low for my BA is the best thing I ever did. I will never want a GA again. Listen to that. Let's screenshot that, guys. It is good, isn't it, Kelly? It is good. I got to second that, actually. Not that I've had it, but I think certainly I think it is going to change the way moving forward we do procedures. I did do some before, but my sort of go-to was general anaesthetic. Because of the COVID and all the restrictions with the hospitals, we have been sort of forced to be doing more under local and sedation, and the surgery is fine. And the main thing for me anyway is the recovery. The recovery is certainly a lot better under local and sedation, and it's not what you think it is. A lot of people think, oh, I don't want to be awake. And right, you're not really awake when you have a local and sedation. You are sort of sedated, hence the title. So it really, I do think, Kelly, thank you for your positivity. Very much appreciated. And I do think it is probably going to be the standard in the next few years. We're going to move towards it in the standard. To be honest, even when we go back to the hospitals and they can do GA, I think we might just be saying, look, why don't we just do local and sedation, because you feel great afterwards. Rather a GA, you feel a bit rough. No, it's not for everybody. I've got to be honest, it's not for everybody. And some people are saying, forget it, and like, absolutely fine. But I think a lot of people are very amenable to it. And Kelly obviously is one, because Kelly can't stop telling people about it. Thank you, Kelly. Excellent. So yes, so awful lot we can do at a local and sedation. And we're actually looking now at GA procedures as well. But as I say, that might be moving out a little bit out and about. So how soon after surgery can I begin breastfeeding? Well, I guess the answer is it depends what the surgery is. I think that would be a fair, because obviously if it's a mole removal, you can just carry on breastfeeding as normal. So, well, let's just assume it's some kind of breast surgery. I think that would be, so if it's not breast surgery, I think it'd be safe to say you don't, that's fine. You can, let me just think about this. How soon after surgery can I be, so you're having, I guess my answer is if it's breast surgery, I wouldn't have the breast surgery anytime around, hi Georgia, Georgia's here. I wouldn't have surgery around the time of nearly needing to breastfeed. So I'm trying to think of a situation where you'd have surgery and then want to start breastfeeding quite soon afterwards. So let's presume you're breastfeeding because you've got a child. Let's work this back. Let's work this out, right? You've got a child. If you've got a child, I normally recommend you wait at least 6 to 12 months after having the child. I suppose. So you could be, okay. Is it a fair? I haven't thought. Sorry, I'm thinking this through live on air. Maybe that's fine. Maybe it is fine. So can we have? What was the context? Let's say it's a breast augmentation. I don't think there's any. A few weeks. There you go. There's the answer. A few weeks. If you really wanted to breastfeed after having a surgery. But the main thing is if you've just had a child, your breasts are going to be a funny shape. They're going to be big because your breasts, I don't think I'd actively do surgery on someone whose breasts are engorged with milk, which they'd have to be if you're breastfeeding. So I think that's what's thrown me. I don't think I would do, I've never had this situation because I wouldn't do surgery if you're in the middle of breastfeeding. finish breastfeeding, let your breast settle, because the size and the shape will settle after your breastfeeding. There you go. That's a better answer. I'll come to it. Can we just cut the bit a minute ago? We'll cut that out. I'll get the people in the office to cut that bit out. Yeah. So how soon after surgery can I bring breastfeeding? Well, I wouldn't do surgery while you're actively breastfeeding. That's the answer. So don't have surgery is the answer. Finish breastfeeding and then wait 6 to 12 months, or maybe not 6 to 12 answer, but 6 months after finishing breastfeeding to let your breasts recover, if you like, let the shape recover, so we can see where we are before we do any sort of surgery on your breasts. If it's not surgery on your breasts, anytime, it shouldn't affect your ability to be able to breastfeed if you're having sort of like your mole removed or something. Crikey. Didn't do that very well. Anyway, gastric fantastic. Your website is amazing. I can't believe your results. You're gifted. I can't wait for my turn. Thank you very much. Gastric fantastic. And I'm sure your gastric fantastic WLS Facebook group is equally fantastic. And thank you for that bit of appreciation. Awesome. Awesome. Right. Oh my God, we've got quite a few questions here. That's good, isn't it? Right. What about this one? Birmingham is a high-risk area with new lockdown restrictions. Will this affect my scheduled face-to-face consultation? No, not at the moment. The lockdown restrictions in Birmingham are more around household to household, because I think they're worried about spread during households. So certainly as far as the clinic goes, and I think there's a question, I have reason to believe we've got a question, yes, we have, about what measures we got in the clinic, which I'll talk about. But in answer to this question, no, it won't affect your face-to-face consultation. We are still doing face-to-face consultations at the clinic. We are encouraging people to do stuff virtually if they can. So I'm doing consultations like this, video consultations, so is Kuram, and we're doing so we're doing virtual ones as much as we can. But if you want to come to clinic, and obviously if I need to examine you, then coming to clinic is still absolutely fine, although there will be not restrictions, measures in place, which I'll talk about in a minute, because I think that's a question. So yeah, absolutely fine. At the moment, we're not in proper lockdown like the old lockdown. We're just in a sort of limited type lockdown. Yeah. Is a virtual telephone consultation benefit for BBA interest, or should I reschedule my face-to-face initial consultation for some time after COVID? I'm worried about COVID-19, so I was offered a virtual consultation. Is this worthwhile, or am I better rescheduling my face-to-face consultation instead? I do think it is beneficial. I've got to be honest with you. When you're thinking of having breast implants, there's an awful lot to talk about. There is an awful lot to go through. Now, I do have to see you at some point and examine you at some point. So there does have to be a face-to-face consultation at some point. But it is quite nice, to be fair, to have a virtual consultation first, where we can talk about stuff. I can show you the before and afters. I can tell you about the different types of implants, different types of textures, different types of coatings, different types of shapes, profiles, talk about some of the ins and outs, some of the issues around breast augmentation. And it's quite nice to talk about that, first of all, because it will mean that when you come to clinic, we can just get down to examination and trying to work out what the right implant for you is. And also I can go over it again at the clinic, because to be honest, I think it is always good to go over things more than once. I think if you just come for a breast augmentation consultation, there's quite a lot of things to talk about, and it is a bit overwhelming. So if we can package some of that stuff off into a virtual consultation first, and then you come for a in-person one, and then maybe have another virtual one afterwards, or maybe another in-person one afterwards, that's absolutely fine. But I think there is worthwhile having a virtual one before your face-to-face. We will go over the same things at the face-to-face, but it's a lot easier if I've gone over it before, because then maybe you'll have specific questions that we can get straight into. So I think it is relevant. I've got face-to-face consultation, but what measures are in place in the clinic? Do I need to wear a face covering? So yes, you do. We have measures in place. So here we go. What measures are in place? We have got measures in place. We have developed policies and procedures at the clinic in line with government guidelines, in line with Public Health England, in line with the plastic surgery associations, who we've all, a lot of plastic surgeons have got together and produced guidelines for ourselves, for our help, as well as national guidelines that we have to adhere to. So there's quite a lot of guidelines in place, and to be honest with you, we are quite well placed because we're not a high volume clinic, to be honest with you, and so we really we have a like 1 in 1 out policy. So we only really have one patient in the clinic at a time. It's not like it's going to be like, busy, so we are I've always been working on a sort of low volume, high sort of high service sort of. That's how we work it. So yeah, so we have a 1 in 1 out policy. We got hand gel before you even come in. We have a questionnaire before you come. Every single visit, there's a questionnaire we will go through to ensure that you haven't got any symptoms or contacts with COVID patients. We have a policy within the clinic so that we have time between consultations to allow air changes in the rooms between patients. We have we wipe down all the surfaces. All the surfaces are wipeable, so whenever you sit anywhere, they're all wiped down after each patient. We have a temperature checks when you come in. We have the track and trace QR code. We have shoe coverings. There's some evidence that maybe some bringing in soil and things from your shoes from the outside can maybe have an effect on transmission. So we've got shoe coverings, and of course, the face coverings, which we you can either bring one and wear one when you arrive, or we have them. We give them to you if you don't have one. So yes is the answer. We have got measures in place, although that's not. Yes, you have the answer. You have to wear a face covering, and there are stuff that we do. Oh, blimey, I'm exhausted. So Dan 9Q9's in the house. Do you offer mini tummy tube? I'm guessing. Oh, here we go. Let's do that again. Do you offer mini tummy tuck? That's better. Do you offer mini tummy tucks? If so, who is suitable for surgery? So, good question. And answer to that question quite simply is, on paper, a lot of people come and ask for a mini tummy tuck. Put it like this: we get a lot more inquiries about mini tummy tuck than we actually do mini tummy tucks. So we do mini tummy tucks, and I think mini tummy tuck is a good operation. And the good thing about mini tummy tuck is the scar is shorter than a full tummy tuck. There's no scar around the belly button. The recovery is quicker. It's cheaper. It's it seems all good for a mini tummy tuck. The reason that we don't do as many is because it is not as good a contouring procedure. It doesn't contour the tummy as well as a full tummy tuck. So that's the balance. That's the balance with any of these mini lifts and mini facelifts and mini breast lifts. The shorter your scar, the smaller the scar, the less the scarring, the less skin that's removed. And a tummy tuck procedure, as I alluded to earlier, is a skin removing procedure. Basically, yes, fat's removed, but it's a skin tightening procedure. So the less skin that's removed, the less of a tightening that it gives. And the candidate for a mini tummy tuck is really someone who's usually had children and they've got a bit of a paunch above their pubic area. Often had a cesarean section scar. The cesarean section scar might be a bit tethered and pulling in, making that paunch look worse. And it's between the cesarean scar or the pubic area and the belly button. If there's a bit of a paunch, bit of a fullness between the pubic area and the belly button, a mini tummy tuck really helps to contour and flatten that area and sort of take that extra skin off. It doesn't do anything above the belly button. You can't get above the belly button when you do a mini tummy tuck because you don't cut round the belly button. So the belly button stays in place. So you can't get above the belly button. So you can't repair the muscles when you're doing divarification of the rectus muscles when they're a bit splayed apart. You can't bring them closer together. And if you do have any fullness above the belly button, you can't really get there and you can't really contour the upper abdomen with a mini tummy tuck, or you can't get significantly to the sides, which is, as I say, the benefit is the scar's shorter. The downside is you can't get so wide as you do with a full tummy tuck. So it's really for someone with a bit of paunch, bit of fullness above the pubic area and below the belly button. Maybe had a children, maybe 1 or 2 children, often got a cesarean section scar, which is tethered, which is makes that look worse. The cesarean scars pulled in and giving you that paunch. So that is your classic candidate for a mini tummy tuck. 2-part question. Second part coming up right now. In a tummy tuck, is the belly button relocated? In a full tummy tuck, it is. So that last question was about a mini tummy tuck. So a mini tummy tuck literally just takes the skin above the pubic area. As I say, if you've got a cesarean scar, we cut below the cesarean scar. So we cut out the cesarean scar and then take a wedge of skin above the cesarean scar and take a wedge of skin from the lower abdomen. So from the pubic area to your belly button, we take a wedge of skin and remove that, and we don't do anything to the upper abdomen. So your belly button gets pulled down a little bit, but it doesn't get relocated. In a full tummy tuck, all of the skin from your pubic area to your belly button gets removed. So if you can imagine all that skin getting removed, if the belly button was just left where it is, your belly button would end up down by your pubic area. Your belly button would end up on top of your pubic hair. Not a good look. Not advisable. So therefore you cut around the belly button, you bring that skin down, the belly button's underneath buried, and then you make a hole in the new skin, which used to be up here, and then you poke the belly button out, and that's when the relocation comes. So your belly button's relocated into that bit of skin that then is pulled down, and that's a full tummy tuck. So the belly button is relocated with a full tummy tuck, but it is not with a mini tummy tuck. So the good thing is a full tummy tuck will contour more of the skin, because that belly button, because you cut around the belly button and the skin from all the way up here is pulled down. That means you can get up to the rib cage. That means you can repair the recti muscles. You can bring them together, so you can do more work on contouring the abdomen, and it's a more extensive contouring of the whole abdomen. But it's a bigger operation with more risks, more complications, and more scarring, because full tummy tuck's got a longer scar as also one around the belly button. So it's a trade-off between having more scarring versus more. One's got more scarring, the other one's got more less downtime. What would that be? More anyway, more scarring or less downtime. That doesn't sound good, does it? More scarring versus more better recovery. Oof. More scarring versus, anyway, yeah, you get the point. One's a bigger operation but gives a bigger result. One's a smaller operation, smaller scarring, smaller downtime, smaller result. Yeah, that's probably a better way of saying it. Bigger operation, bigger result. Smaller operation, smaller result. You be the judge. Whatever's best for you. And full tummy tuck's good for some people, mini tummy tuck's good for others. It's all about being aware of what's possible, the limitations of the operation, so you can choose the right operation for you. It's no good going in saying I want a mini tummy tuck because I want less of an operation, less scarring, etc., if you're not comfortable with it being less of a result, and you're comfortable with the results it can achieve. Because nobody wants all the scarring of a full tummy tuck, but you can't have that result without that scarring. So that's what this game is all about: aligning expectations, my expectations with your expectations, so that we get a good result, which is the game. That is the game. Get a good result. So I tell you what's possible. These are the options, including nothing. Nothing's always an option. No complications, no chance of infection, no chance of unhappiness, no chance of scarring. Well, there might still be a chance of unhappiness, I guess. So these are the options. Which one is right for you? That's something for you to judge. Right. Sorry, I've lost control. Oh, no, I haven't. This is amazing. Can you choose a belly button? No, Celia, you can't choose a belly button. It is your belly button. So we cut round your belly button, and then your belly button drops in, and then we pull the skin down, and then we make a hole in the skin overlying where your belly button is buried, and then we pop your belly button back out again. don't know if that makes sense. I got a video on the tummy tuck somewhere on YouTube where I've done surgery, where it shows the whole surgery from start to finish, and I'm sure it must show that bit where the tummy tuck. So basically, if, for instance, you had a birthmark or a mole on the inside of your belly button, looking, it would still be there. Now, if you had a mole in the skin around the belly button, it wouldn't be there. That would be gone. That would be, if you had a mole up here, it gets pulled down. So you can't choose a belly button. It'd still be your belly button, but it would be it would be in the same place it is now, but the skin around it would have been skin that is higher up now because that skin's been pulled down. So the stalk of the belly button is the same place, because the belly button's on a stalk and is attached to the abdominal wall, which is why actually you couldn't. I said it would end up down by your pubic area. It wouldn't end up down there because I don't think it would reach that far because it's attached to the stalk. But yeah, you can't choose it. That would be good, wouldn't it? I hope that is Rosie has not been here for a while. Hope you're well. Bearing up, Rosie. Bearing up under the strain, trying to keep on the straight and narrow. Thank you for asking. Nikki says that the tummy tuck video is fab. Thank you, Nikki. Did you hear that, everyone? There's a tummy tuck video out there with me doing a tummy tuck start to finish. I thought it was great as well. Tummy tuck, whole lot, start to finish, like time lapse, isn't it? No, I agree. That is a good one. Right. On that note, questions? No, I haven't. I thought I had that was a few. I think we've done a few, haven't we? I think we can be pleased with ourselves. I will be here, same time, same place next Tuesday, 7 o'clock. If you've got any questions, post them to me and I will be more than happy to talk about them next week. If you haven't got questions, fine. Log in and see what other people are asking, see what's going out there. Keep yourself informed about questions in the plastic surgery fraternities, because I think we can all be better people for knowing what's going on. Seeley's in last minute, nice one. Totally irrelevant, good start. And if you have time, can you tell me, after many surgeries to remove infected hair follicles 20 years ago when I weighed 21 stone, oh, don't sweat at all. Hold on a minute. Oh, don't sweat at all. But I have no feeling at all, underarms. Will it ever come back? So, Seeley, this sounds to me like surgery for hidradenitis suppurativa. Hidradenitis suppurativa is a problem in the sweat glands, often involves the armpits and the groins. Very difficult problem to treat. And there's a variety of operations that can be done, from just excising that local area to excising and resurfacing with skin grafts, which obviously don't have any sweat glands. It's often a problem with the sweat glands, Seeley. To remove infected hair follicles 20 years ago when I weighed 21 stone, don't sweat at all, but I have no feeling. So, oh, here we go. I have no sweat glands at all, but body is numb. And yes, I just couldn't spell it. Yeah. Hidradenitis suppurativa. Yeah, that's not an easy one to spell. Will it ever come back? 20 years ago, no, Seeley. I think probably not. And I don't know whether the skin was excised and directly closed or if it was skin grafted. But it's an extremely difficult problem to treat, hidradenitis. It's got a high risk of recurrence. So I'm saying it's a good news that you're 20 years down the line. So it sounds like they've cured you, which is fantastic. And the fact that it is numb is probably, I would say, I mean, I've got nothing to do with this and I'm nothing to do with your surgery, am I? Did I do your surgery? But anyway, that I would say is just a sequelae of the surgery, and actually not that bad a one. The bad things is when it keeps on coming back, because it can, and it may well be, if you've had all that skin removed, that you may have numbness there, which isn't great, but it's probably the price you have paid for having all that skin removed, because it's quite extensive excisions you have to do for hidradenitis. So I suspect if it's still numb 20 years later, I'm sorry to say, it probably will remain numb, Seeley. So I would, yeah, that's what I would say. Kelly, thank you, JJ. Thank you for my amazing results from BA last week. Perfect. Look at that. Kelly, can you just copy and paste that and just drop it in next week as well? Yeah, but just say from my amazing results from BH 2 weeks ago on a weekly basis. That's what we need. Just, oh, Celi's put another comment in. I don't want to come off this one. Oh, can we just leave that one on there? Have you all seen that one? Screenshot that. Everyone okay? Should we move on? Thanks, Kelly. Thank you, Kelly, for being an amazing patient. I've got to be honest with you. It helps. All of patients are amazing, but Kelly's particularly on. A big shout out to Kelly. If I could thumbs up, I would. Well, I'm going to. Celi, amazingly, I had open wound for over a year and so many grafts, but one only thing that healed was local honey. Honey's amazing, Celi. Honey is amazing. Selena has hidradenitis. Selena, look at that. Celi, you're going to be, in fact, arguably you have been more popular this Facebook Live than I have. Someone else there, Selena, that can connect with you. Hidradenitis is a terrible problem, and it is a very difficult problem to correct. And you said, I think, Celi, that you're a bit overweight. So losing weight, stopping smoking. So if you're overweight and smoking, and I'm not, those are the two first things: lose weight and stop smoking. And then you're looking at local things, and then surgery is sort of a last ditch. But surgery is really difficult. It's really difficult to get on top of hidradenitis. It's a very difficult problem to correct. Kelly's thumbs up, right back at you. Ophelia, my surgeon now retired was Roger Smith, and was and he was like, no, Celi. Stop it, and orders medical honey. It worked within a few weeks. Yeah, honey is a great dressing. I second that. For problem wounds, honey is a great dressing. Honey is an amazing thing. Yes, you heard it here, guys. Honey dressings, fantastic. Chronic wounds, not something obviously that I deal with because everything heals up beautifully when I do it. But if you do have a chronic wound, honey is a big thing. I've lost 5 stone, wow, and stopped smoking, and my flares are worse. Waiting to start the injections this week. Selena, I do think that stopping smoking and losing weight is a good thing to do, though, and so well done on that. And good luck with if you're starting treatment this week. Good luck with that. And yeah, as I say, it's a difficult problem. Any way you cut it, it's difficult. Celi will tell you that. She's 20 years in. Yeah, medical honey instead of yeah, you can get honey dressings. Yeah, it's not just honey. Well, I don't know. Could you put honey on it? I suppose if you're in the jungle, you could put honey on it. But yeah, we use medical honey. There are honey chewel and honey dressings. Thank you, Selena. Thank you for that. So, Selena, inbox Celi. She's waiting to help. So I didn't know it's medical. Never seen the honey dressings. Yeah, honey. Selena, I think again you probably work with your surgeon. Honey dressings are really good for surgical wounds once you've had the hidradenitis. So hidradenitis is usually chronic infections around the sweat glands. And so it's really good when if you do have surgery and you have problems with the healing around the surgery. If you haven't had surgery and you just got hidradenitis, then you look at maybe perhaps different things, because you've got to look at maybe if there is sort of low-grade recurrent infections, you've got to look at maybe treating the infections or maybe using appropriate dressings for the issue. But yeah, this is something your doctor will be able to help you with. But I would. And personally, I've used it in terms of the surgical wounds rather than actually treating the hidradenitis primarily. Would they help after something? Selena, they would help after it. If you have a chronic wound after anything, honey is a good dressing. It's not the only one. There are lots of good dressings. To be honest with you, you don't normally have a chronic wound after a tummy tuck. You might get a little bit of wound breakdown, but that heals with a good, good diet and good, good wound management. You don't normally need something like honey, but it certainly wouldn't do any harm. But it's more for chronic problems is where honey dressings really come in. And it would work for any chronic wound. It's really good. It's not the only one, but there are others available, but honey is very good. On that note, I am going to check myself out of here, and I will be, to be fair, I sound, would they have, to be fair, I sound well sexy. I sound well sexy, yeah. Nikki, I'm so excited for my surgery with you. More nervous about the COVID test. Yes, I don't think it's that big a deal to do a COVID test, Nikki. Don't worry about that. But if that's what you're more worried about, that's not a bad thing. If that's what you're worried about, because that means you're not that worried about the surgery. No, honey won't help infection. Right. Well, yes, if you've got infection, you have to look at treating that. But we'll look at this. Seeley's a right expert, but will help heal. Seeley is. Would you do a breast uplift with scars of hidradenitis if no flare active there? Yes. Are the scars of hidradenitis where the breast uplift scars would be? So, I mean, you can get it in the fold. It's less common there. Don't think I've ever seen it there, to be honest with you, in the fold. That's more like intratrigo, which is a slightly different problem, which is infection in the breast fold. And it doesn't normally leave scars. So you'd have to look, if you've got scars in the area where your breast scars are going to be, you'd have to look to see whether that's going to be an issue, because you've got to be careful crossing scars because of blood supply of skin. So absolutely right about the flare of hidradenitis. So if you've got a flare of any infection, but particularly something like hidradenitis anywhere, even if it's in your armpit, I would not advise you having elective surgery like a breast uplift. But if you've had hidradenitis in the past with scars, particularly the scars are elsewhere, like your armpit or your groin or something, there'd be absolutely no problem with doing a breast uplift. But if the scars are around your breast, we'd have to look at where the scars are and where the scars of the breast uplift are going to be to see if there's an issue with the healing. Listen to your doctor. That's, well, I am a doctor, but yeah, listen to your doctor. You're absolutely right. This is something people don't want to talk about, but true, and we have been there. What's that? What don't we want to talk about? Is it wound healing and honey dressings? I think it's a good thing to talk about, Seeley. Good thing to talk about. People with chronic wounds, this can be really depressing. So it is a good thing to talk about. So good. Oh, I think Instagram's finished. Is Instagram finished? All right. Oh, there you go. Didn't even notice. Hi, bye, Instagram. Thanks for coming. Okay, that is me. Oh, hold on. What's going on? Brilliant. Thank you. Very helpful. Scars are from hidradenitis where they have done drainage, but that's presumably in your armpit, Selena. That's not near where you'd have a breast. The breast lift scars are in your lower part of your breast. So I presume it's in your armpit where your scars are. Sharon, yes, kicked. Yes, off. Instagram's kicked off, has it? Oh, well. Sorry about that. Thanks for coming, Instagram. Don't want to be rude. Kicked us off Insta. Oh, dear. You get an hour limit on Instagram, Sharon. Sorry about that. So I'm over my limit. I can start again, but I don't know if there's any point. Is there any point in starting Instagram again? Am I going to be saying anything? No boobs. No boobs, no Instagram. Oh, no boobs. No scarring on your boobs. Yeah, if there's no scarring on your boobs, a breast uplift will be fine with scarring from hidradenitis. But again, I think you alluded to the fact you lost 5 stone. You've got to make sure you're stable with your weight, Selena. So if you're continuing to lose weight, then I would not have a breast uplift, because if you have a breast uplift and then you lose weight, they could sag again. So that's something to bear in mind. So get your weight right and stable first, and stay off the cigarettes. You don't want to be smoking if you've got a if you're having a breast uplift. But I think you said somewhere that you stopped smoking. Yeah. Whew. Right, good. So thank you all for participating. Very nice to talk to you all. Very thanks for your activity and your joining in. I will be back at Tuesday this next week. Night, you all. If you need a weight loss surgery advice, then Gastric Fantastic Facebook group. Celie Shakespeare's your girl. Message her. She's happy to be messaged for a weight loss for Gastric Fantastic Facebook group. Also, hydroadenitis advice. Celia also is your girl. So look at that. And Selena, thank you. I'm glad I've been of help with hydroadenitis. It's been a while since I treated that, but I do know that it is a hard one to treat. So good. I'm going to check out of here right now, and I will see you. Oh, hold on, Jackie's in. Look at that, Jackie. I know for a fact that Jackie was here at the beginning and she's here at the end, so there must be some kind of award for that. I had to have honey dressings, then silver plasters after mastopexy. Thank you, JJ. Yeah, so you presumably had a wound healing issue. Yeah, I mean, silver also is good. So honey and silver are both good for wounds. And Jackie's had the lot. So yeah, but I've got to be honest, normally normally you mastopexy's healed within a week with maybe a little bit of breakdown at the T-junction, and it's not a huge problem. Certainly the wound problems after mastopexy are, I mean, you can get bad wound problems after any surgery, particularly body contouring, because you're closing wounds tight, but you don't normally need significant dressings after body contouring, unless of course you smoke, right? If you smoke, right, and do body contouring surgery, disaster is potential. So yeah, I mean, I think if you smoke, don't have a mastopexy, Jackie. I think that's probably not helpful to say to you now because you've been through it all, but it can be a problem, wound healing after smoking. Yeah, fair point. But in terms of wound healing and cosmetic surgery, it's normally not a big issue. It's a different kettle of fish to things like hydroadenitis, which is a well established nightmare thing to treat. But the trick is to try and stop smoking if you're going to have any sort of tummy tucks, mastopexies, facelifts, stuff like that. Whew. So just Jackie, thanks for sticking it out, and anyone else who also stuck it out from start to finish, we salute you, and I will see you right here 7 p.m. Tuesday night. It's a date. See you then Instagram, even though you've already stopped quite some time ago. Hasta la vista. Stop the stream.